6:44 to our Facts Not Fear coverage of COVID-19. Federal health officials are now warning in newly hard-hit COVID areas to re-examine reissuing masking indoors. And that's just one of many COVID-19 headlines we have for you this morning. And that's why we have a member of our 10 TV team of experts, familiar face, Dr. Joseph Gastaldo, joining us to provide some insight into this rise in cases we're seeing now. Today we'll get some new numbers, and there's really been this upward trend for the past 6 weeks. Dr. Gastaldo, what are your expectations for what we'll hear today?
Good morning, Tracy. It's nice to see you again. Yeah, you are right. There is more COVID out there in the community. There is more community transmission. However, in the context of Omicron, it's nowhere where we were in the winter. In the hospital, we are not seeing a significant amount of increases, and more importantly, there's not any stress on the hospital systems. I think moving forward, we will see more COVID out in the community, but what's different today is we have vaccines, we have more people with immunity, but more importantly, we have outpatient treatments. So for anybody listening to this, if you have an at-risk condition, stay up to date on your vaccines. But what is your plan to get tested? But more importantly, what is your plan to get the outpatient pills that are more readily available in retail pharmacies in Ohio? These outpatient pills are another layer of protection, and the clinical trial really reduced the risk of being hospitalized or dying significantly.
And can you also talk about, Dr. Gastaldo, the COVID boosters, because there's some new research out that says that those are very helpful too.
Yeah, without a doubt. Clearly, Tracy, we need people to be up to date on their vaccines. And currently, being up to date is one booster. Why is that one booster needed? It's all about Omicron. We have data from Israel and even in our country that without receiving a booster, especially in senior citizens and elderly and at-risk individuals, there is a higher rate of having a bad outcome, like being hospitalized or dying.
We are showing some video, Dr. Gastaldo, of it's file video of people in their masks, and we saw that warning about these newly hard-hit areas being asked or to consider re-examining masking indoors. Do you think it's wise to bring back those kinds of mandates to curb the increase in cases?
Well, I hope not, but I would also ask the public really to follow the public health guidance that comes out by the CDC and even at the state and local level. So right now, the CDC has a community level, and the state of Ohio, with the exception of Lawrence County on the Ohio River, is green, meaning that there's low community level. And that's really an emphasis on what's going on in the hospital. However, if we do get to high community level, the CDC and public health recommendation is for everybody to wear a mask. Nonetheless, for those people who are immunocompromised and for those who have at-risk conditions, it is a good consideration to consider wearing a high-quality mask, such as a KN95 mask, in public indoors.
Okay, I can't let you go without talking about another virus making headlines, monkeypox. What do we need to know?
Yeah, so monkeypox is an uncommonly seen and very rare viral infection. It's related to smallpox. It was identified in the 1950s in Central Africa. The symptoms are really headache, nausea, enlarged lymph nodes, and then 2 or 3 days later, people really get very impressive types of skin lesions, and they could fill with pus. We have had monkeypox here in Ohio in 2003. It's mostly associated with contact with exotic animals. And what we saw in 2003 were people getting it from imported prairie dogs. So in Europe, there's about close to 40 cases of monkeypox that has been identified. We're watching that, trying to figure out. And then most importantly, there's a case in Boston. Okay. So we don't know really how these people have gotten monkeypox, and to be determined.
All right, so we know who to come to. We don't want to see those pictures again, though. So thank you so much for your time this morning, Dr. Gastaldo. It was great to see you. We will certainly be back in touch. We appreciate having you on. Okay, and so the moment, friends, that ODH releases those new COVID-19 numbers today, we are going to alert you on our 10 TV app and under our Facts Not Fear section at 10tv.com/coronavirus.